What is the difference between a CT scan and an MRI of the brain and spinal cord?
Yeah, so a CT scan uses X-ray and has radiation associated with it. An MRI uses magnets. MRI is a better study for understanding the parenchymal architecture, looking for things like stroke. CT is very good, and they are getting better. I think I saw a picture not too long ago showing like the first CT image and just comparing it to maybe one of the ones that I showed today. It's just remarkable what we're able to visualize now on CT. The one thing CT is a little bit better for would be bone, like understanding bone, like fractures and things like that. You can visualize them better, but it does have radiation. So for example, in a pediatric patient who comes in with a suspected head injury, we're not getting CTs, we're getting ultra fast MRIs. So just a couple of sequences of MRI to understand what's going on. So they both have their utility and are pretty essential. Although, you know, I do wonder sometimes about, we obviously all have concerns about radiation exposure. You know, a couple of CTs is not like a horrendous thing for a patient to get, but it'll be interesting to see if there's going to be like a new imaging modality in the future that will totally replace CT. In fact, some of the folks that have trained me, you know, were around when the first CTs came out, and just, I don't know, I had a moment one time when I was looking at a patient going into a CT and I was wondering, like, you know, one day this device is going to be obsolete. Amazing experience like that's going to be to just reduce that you know, need for radiation or you know, have something better in the future. So, but those are the major differences between the two.
Thank you for that answer. That was